Our first guest is Dr. Ted Parcel, an orthopedic surgeon with Novant Health Orthopedics and Sports Medicine. Welcome back to the show, Dr. Parcel.
Great to be back, thank you.
Seems like you were just here not long ago, a few months ago.
Yeah, something like that.
Yeah. Well, I appreciate you coming back so soon, but I know there's an exciting announcement to make. We briefly touched on something going to happen, and it's finally happened.
Yes, we've been working on it for quite some time now about getting a robotics platform here to perform knee replacement surgery. And we just obtained it here several weeks ago, and we're up and running already. So, and we can get into it more as we sit here and discuss it today.
I'm really excited about this. Now, I know that this isn't your first rodeo with robotics. You have performed them in the past, correct?
Correct. Years ago, prior to coming here, I had one of the first platforms, and I actually performed the first robotic total knee replacement in the state of North Carolina. And that was back, I believe, in 2017. But since then, the technology's evolved quite a bit, which has made it considerably easier, faster, more reproducible, and frankly, just easier to use.
That's exciting that you performed the first one in North Carolina. That's something to be very proud of.
Well, thank you. Yeah, it seems
and
it was quite a while ago.
I'm going to talk about that.
Sure. It was early on in the process with the software was a bit more cumbersome and it took some time, but it's amazing how far it's come and how the platform that we have here, the CORI from Smith & Nephew, is small and compact, it's portable, it's easy to use.
Yeah, that's amazing.
And we can get into some more of the specifics here.
Yeah, I knew it would get smaller. Everything gets smaller over
Sure,
the
yeah,
years.
look at your phone and everything else.
Yeah, look at the phones. We used to have one of those big old...
For sure, I remember those.
You're too young.
No, I had one of those, I remember back in the day, oh yeah.
So, using a tool or a platform like this, the Smith & Nephew CORI, what would be some of the benefits for the patient?
Sure. What we know is when we perform a total knee replacement, we're trying to hit the bullseye of the target every time.
Yeah.
And with our standard instruments, you have a little bit of a scatter around the bullseye, but with the robot, you're going to hit real close to the bullseye every time and make you more precise, more reproducible, and more accurate time after time. And we can see very subtle changes with the robot that you couldn't perceive before with just your eyes and your hands.
Yeah, yeah. How about you? Does that work better for you? Are you happy?
Yeah, we're finding it out, and it has been a very interesting and eye-opening experience. Okay, you look at certain things intraoperatively about here's what I think, and then you sometimes you can corroborate it on the computer. But also sometimes, you may want to move something very subtly and to make it even what is very good even better. And the goal is to optimize outcomes for our patients.
Yeah. How do you decide which method is better?
We're using it on nearly everybody now.
Really?
Yes, and it gives us some flexibility on some of the more complicated deformities, some patients where we can't use standard instrumentation who have previous hardware in their bones from surgeries years or prior, and it allows us the ability to be more accurate and gives us an alternative for those patients. But we've been using it for nearly everyone.
Well, that's interesting. Can you sort of walk me through what a knee replacement looks like?
Sure. The difference is a standard knee replacement is the skin incision down the middle of the knee, a few inches long, and using standard instruments and cutting guides to remove small layers of bone that are just about 8 to 9 millimeters thick, depending on the deformity of the patient. There are a lot of misconceptions by patients in the community that we're taking off a big chunk of bone and lopping off this and that. Not so much. It's basically resurfacing the ends of the bones with the cutting guides. But now what we do with the robotic guidance is we will insert 2 pins through the incision into the bone of the femur and 2 into the tibia to tell the computer where the knee is in space.
Oh.
So you can have the knee straight, bent, to the side, right, left, however you like, and the computer knows exactly where it is. And we will take some tools and we will recreate the bone on the computer.
Oh.
We have a probe that has infrared connection with the computer, and I can swipe around the bone, and you can see in real time the bone being recreated on the screen. And what you do after that and a few other motions, you can figure out the alignment of the patient, where you need to place your implants. And the robotic arm helps you guide in doing that and positioning your guide so you get it just right.
Well, I saw a picture of it, and we're going to show a picture
Yes.
of that of it to our viewers, but it doesn't look like it takes up a lot of room. But do you stand near the machine, or you?
Yes, my hands
how
are
does
still
that work?
hands-on. This is very
Okay.
different. Some patients
Very
may be
different than the typical robot.
the
that we
other
think of.
robot platforms that, particularly with general surgery and urology,
Right.
that use, that's more of a hands-off where the surgeon is off to the side. Here, my hands are still on the patient at the side of the operating room table, performing the surgery with the robotic arm in my hand. And there are a few different platforms out there, but the one that we have is based on a burr, a high-speed burr that prepares the bone, and I can follow it in real time on the screen. And when you get the burr where it needs to go, it'll resect some bone, but if you deviate outside that, it'll stop and pull back. So you can't,
Isn't that amazing? You can't make a mistake.
in real time, and the refresh rate of the software is incredibly fast. It's faster than a blink of an eye that it'll stop you and pull you back. But it helps, it keeps you even more accurate that way.
And so you can use this on a revision also?
You can. It's not fully approved for that. We
that,
can use it that way and help us with some alignment in certain conditions as well. And there's some research being done now to use its application into hips, which is still,
Wow.
it remains to be seen, but we're still trying to figure that out. But we can use it for...
At some point, maybe.
Yes, we can use it for partial knee replacements and total knee replacements, and some revision alignment issues we can also tackle with it as well.
Wow.
And one of the biggest advantages of our platform is that it doesn't require a preoperative CT scan.
That's very important.
And one of the other systems that's very common, patients have to have a CAT scan done. So you either have to come to the hospital or an imaging center, and it's more cost for the patient, more radiation, and it actually adds a layer of complexity where something could go wrong. What happens, that CAT scan doesn't load properly, the patient's in the operating room, and so on and so forth, where it becomes more of a, it can be more of an issue. Ours, we recreate the bone in real time in the operating room, irregardless of some preoperative CT scan.
Yeah, well, it's also going to be cheaper. You don't have
Yes.
to have that pre-op CAT scan. So, and it decreases the amount of radiation that the patient
Yeah, and there's less
exposed
cost to the patient. This day and age, and given what our economy is presently going through, saving patients some money is a great benefit to them.
How about recovery time? Does this help patients recover?
We think so, and out of necessity with COVID, we were moving forward to outpatient surgery, and I've been doing a lot of hip and knee replacements as an outpatient, where patients are going home.
Yeah, that's
where
true.
patients
That's
are
what I've
going
heard.
home the same day, and it's been great. And patients are able to go home and sleep in their own bed, wear their own pajamas. They're not being
That's nice.
poked for vital signs or labs. They're doing
exactly.
great, and we can see them the next day if we had to in the office.
Right.
But we're having most of them seen by home health the following day, and it's been exceptional.
Wow, that's a lot of great information. I hope you'll come back real soon, because I'm sure we're going to have more information on this, and I'm looking forward to the hip replacement.
Yes, well, great. Thanks for having me again. I appreciate it.
No problem. Thanks again.
Thank you.